Okay, so today I am really excited to talk to y'all about HeaRT, or formerly known as dating matters. So on the screen, you can see kind of what the dating matters model is, but to relate it to the previous presentation, it was informed by NISVS data. I saw a few people mention YRBS data. It also informed the development of this model, and it also accounted for existing research to focus on those preteens most at risk and follows the science and data to action framework, which I'm sure you've heard about in previous webinars. So I've been at CDC for about 10 years and started as a research fellow on dating matters. I am going to start off with the background information, kind of how it was developed, the science and the outcomes from evaluation, and then hand it over to my team member, Stephanie, who will share some exciting updates from this year. So starting in 2009, CDC began developing dating matters to address the problem of teen dating violence. Dating Matters is a comprehensive prevention model that focuses on teaching 11 to 14-year-olds healthy relationship skills early. So relating it back to the presentation Kathleen, Sharon, and Matt just gave about NISVS, that is a lifetime prevalence when SV, stalking, or IPV have already occurred. The goal with Dating Matters is to get at preteens and teens before they even experience that first act of violence. What makes Dating Matters unique is that it includes multiple coordinated prevention approaches to address the risk and protective factors across the social ecology or the social ecological model. It includes strategies for the teens themselves, as well as their peers, families, schools, and neighborhoods. So on the right side of that graphic, it kind of depicts outside of that main dark circle, levels of the social ecology. So at the top, you've got the dark blue spokes, which are the community level components, the capacity assessment and planning tool, the guide to using indicator data, and then the guide to informing policy. Moving to the right, to the lighter blue, you have the individual and relationship level components, which are the youth and parent programs for students starting in 6th grade that goes to 8th grade, and then parent programs for parents of 6th graders through 8th graders. So then moving towards the darker teal, you've got the community and relationship level continued in the training for educators, and then the eye-to-eye youth communications campaign. So all together, these 7 components work to reinforce protective factors and then reduce those risk factors for teen dating violence. It also focuses on preventing dating violence and promoting healthy relationships across the lifespan. The other thing that makes Dating Matters a little bit different than other prevention models for teen dating violence is that it was designed to engage local public health departments in the prevention planning process and build on existing evidence base, including some programs with already known effectiveness. So that's the big background about the model overall. I'm going to talk through the pilot project, which is started in 2009. So to get the pilot project off the ground, our subject matter experts did literature reviews to look at what was already out there to prevent teen dating violence. At that time, there was nothing that targeted across the social ecology, but there was an evidence-based program called Safe Dates, which was being implemented primarily with high schoolers, and Families for Safe Dates, which is implemented with their parents. There were a few existing evidence-based programs for topics tangentially related to violence prevention. And so for the 6th and 7th grade programs, CDC adapted those to incorporate research evidence about what works to prevent teen dating violence and kind of build our own 6th and 7th grade programs. For the 8th grade program, we used Safe Dates as it was the existing and most widely used evidence-based program to prevent TDV in the US at that time. Combined across the 6th, 7th, and 8th grade programs, the core goals remain the same: to address healthy and unhealthy behaviors in all relationships, include the role of social media, cell phones, texting, and phone apps in relationships. And then other risk factors for teen dating violence, like substance use, risky sexual behavior, and poor coping skills. Just a note about safe dates in general is that it also served as the standard of care comparison program for the pilot program's randomized controlled trial, which I'll talk about in a second. Okay, so moving from the youth program development into the parent program development, when the scientists got the request from Congress and the administration at the time to develop dating matters, one of the biggest requests was to include parents as part of this effort. So we adapted a sixth grade parent program from an existing program called Parents Matters, which was being implemented in the Center of Global Health at CDC. There was some evidence from evaluation going on of that program that it could prevent teen dating violence victimization. The program includes guides, or the programs include guides for parents to interact with their children. The seventh grade program is very similar. It builds on the sixth grade program in that it talks about sexual behaviors and consent and risky behaviors and sexual health. And then finally, the eighth grade program was Families for Safe Dates. And it was, of course, an existing evidence-based program. So the graphic on the right depicts how the RCT was combined. The idea was that if we compared Safe Dates, which we knew was an existing evidence-based program, to what became Dating Matters with all of these additional components, how much of an effect would the additions have above and beyond that existing evidence-based program? So from 2011 to 2016, we conducted a pilot project with 4 communities across the country to examine the feasibility, sustainability, effectiveness, and cost of this comprehensive model for prevention. So youth in 6th, 7th, and 8th grades were surveyed annually to assess their exposure to dating violence and related behaviors. Some students were also surveyed as they began high school to examine the long-term effects of dating matters. So this rigorous longitudinal randomized controlled trial provides the strongest evidence we have right now to understand the effectiveness of the dating matters prevention model. Okay, so given that we developed all of that stuff above and beyond Safe Dates, what were the effects? So on the screen are data from the middle school and high school evaluations that showed dating matters reduced the risk of violence and risk behaviors by 3 to 11% on average in middle school compared to another evidence-based program. The risk reductions represent the average significant risk reduction for each outcome across groups and across time points. Dating Matters, the big reveal back in 2019 when our middle school evaluation came out, was that Dating Matters did indeed prevent perpetration and victimization of TDV as intended. But then we also found more effects over and beyond what we expected because it had impacts or effects on other forms of violence and adolescent risk behaviors, as you can see in the tables above. So these findings point to the potential for achieving greater effects on health and behavior with the implementation of one comprehensive multi-component prevention model to address shared risk and protective factors. So this kind of ties in, I don't know if y'all have been on other webinars where we talk about connecting the dots in that framework of targeting shared risk and protective factors, but Dating Matters is the standard in our first program as a division that really does that. So after we did the middle school evaluation, we did the high school evaluation and published those findings in 2024. They continued to show many of these effects persisted into high school. Students who received Dating Matters in middle school continued reporting long-term outcomes for reduced TDV perpetration and victimization and also bullying perpetration, which were amazing findings. So taken all of this evaluation data, in 2019 when I started, my background is in social work. I worked at a domestic violence agency in Metro Atlanta. I don't know if we have any Georgia Coalition folks on, but shout out to y'all. One of my jobs as a research fellow at the time was translating all of the data into a nationally disseminated model. For the randomized controlled trial, we spent a lot of resources paying communities to implement this very rigorous study. What we wanted to do in 2019 is make a model that is more sustainable for communities and provide all of the implementation materials needed for the model at no cost to communities on a publicly available website. So that's what we did. And on the screen now is what the Dating Matters Toolkit looked like in 2019 when we launched. As I mentioned, the goals were to increase adoption, support quality implementation of an evidence-based prevention model, and then build sustainability for communities, because we know these prevention efforts can be costly, especially at the scale we did for the RCT. So we designed it to give communities everything you need to kick off and sustain Dating Matters. In addition to all of the materials for the youth and parent programs, we provide a guide to implementation for the person or role overseeing the implementation in a community, a coach's playbook. So this is the person coaching the facilitators to make sure they're implementing the programs with fidelity and to guidance. And then we also included an online training for those youth and parent program facilitators to replace what was the costly technical assistance of in-person training. So I am proud to report that since we launched the toolkit in 2019, more than 300 communities have access to training and started implementing the model. That does not include it being implemented internationally. We've had governments from Peru, the Ministry of Education, and Sweden's Gender, Health, and Equity Alliance reach out for a consultation on how to adapt the model for their local context, which has been amazing. And the Dating Matters Toolkit also continues to be one of the most viewed resources on Veto. We know contexts have changed a lot since 2019 when we launched the toolkit. So we are continually trying to improve and update it to help get the communities or the materials that you all need in your communities and increase the reach and accessibility of the model. So now I'm going to pass it over to my colleague Stephanie, who will talk about how we're doing that and exciting updates from this year. So Steph, I'll pass it to you.
Okie doke, thanks. All right, so as Ruby mentioned, the program has been very successful. So if it's been so successful, then we want to keep making it great and updating it. So that has included a rebranding. Why a rebranding? Well, since the toolkit launched in 2019, we've received lots of feedback from community partners and implementers sharing concerns about the name. Parents and key decision makers say that the name inadvertently implied that dating is important for middle schoolers or kids should be dating in middle school. Some parents in schools were confused or concerned by the emphasis of dating. We had some schools in the Chicago area pull out from implementation because of the concern. And some sites admitted that, yeah, we like your program, but we're actually going to use a different name when we implement. So taking all of that feedback into consideration, and then just like Sarah mentioned earlier, our research showing that the model reduces other forms of violence and risky behaviors in adolescents too, like bullying, sexual harassment, and weapon carrying, that led to the name change. So you might have heard Sarah mention it at the beginning. Dating Matters has become the Healthy Relationships Toolkit. So we are excited about this new name, and it's also known as HeaRT. But we're especially excited because the new name better reflects the research and the feedback from community partners, as it emphasizes the program's core focus of supporting adolescents as they build healthy, respectful relationships with peers, parents, and partners. So as we were rebranding, we also made some content updates. So we updated our statistics. We added some more information about technology facilitated violence. We made some edits so that we were more responsive to community needs. We streamlined the implementation guidance, and the program evaluation guidance was updated. One of my favorite things that we did was we also added a new online training for parents. So, as you know, parents are pretty busy. They have lots going on in their lives. So, since we launched, the parent program has mainly been delivered in person, which poses huge challenges for parents. It can be hard to find transportation, find childcare, find an actual space to meet together, or time to meet. So, we thought it was very important that we make some edits and adapt to better meet parents' needs. So we developed this new online parent training, which takes content from the in-person parent programs and frames it in an online interactive format. So it is free and it aims to provide parents and caregivers of 11 to 14-year-olds with positive parenting skills and effective communication techniques, while also helping them engage in conversations about healthy relationships. There's 2 parts to the training, and each part takes about 60 to 90 minutes to complete, but it can be covered at your own pace because you can log in and create an account so that you can start and stop when you need to if you have stuff going on. And my favorite part about the training is how interactive it is, because we have all sat through a training that is just very boring and monotonous. So I love how interactive this training is. So we have videos. On the left, you'll see a video. We have some unscripted ones where we've asked teens and parents questions and they give honest answers about what we are asking. And then we also have videos that are scripted, like the one you see on the right, where we have a scripted dialogue that tells a story and helps illustrate some of the concepts that we want to make sure are covered. We also have lots of new statistics, like I mentioned, and interactive ways to flip through and learn more about these statistics. And then we also have some interactive fill in the blank kind of scenarios where you can go in and drag and drop different characteristics into a form that you can then, once you finish your pyramid, like this example, you can download it and print it if you want to save it, or you can clear it out and make a new pyramid for another kid. Lots of opportunities for interaction and just lots of really great content that is just very exciting, I think. So future directions. We are going to continue to keep an eye on who's using the model and how much traffic it's getting. We're going to continue to work with our partners to make sure that people know about it and know how to best access these resources. And then finally, we're going to continue to encourage evaluation and implementation studies of the updated model and the specific components. It's been a lot of hard work and we're very, very proud of it all. And we're so excited for you guys and communities across the United States to use it.